Septic shock is described as an autodestructive process that permits the extension of the normal pathophysiologic response to infection, resulting in multi-organ dysfunction. Multi-organ dysfunction is the number one sign of sepsis. In other words, there is a source of infection in part of your body, and then that infection gets into your bloodstream, which then leaks out of the bloodstreams and get into other parts of your body, such as your organs, and then which can lead to death. That is a summary of what septic shock is. Sepsis can cause pulmonary dysfunction, and it's caused when infections have injured the type 2 pneumocytes, which will cause a decrease in surfactant production, making the lungs stiff, resulting in acute lung injury or acute respiratory distress syndrome. Most patients that develop septic shock have an underlying condition that interfere with local and systemic host defense mechanism, such as diabetes or a weak immune system. Major complications that may cause septic shock are trauma, major surgeries, extensive burns, invasive procedures, immunosuppressants, prolonged hospitalization, and some causes of shock are lower respiratory tract infection. That accounts for 35 to 55% of septic shock, and 20 to 40% of septic shocks are causes from abdominal or GI tract infections, and 10 to 30% are causes from UTIs. Septic shocks affects all ages, mainly patients greater than 50 years old, seen more in male than females. Some signs and symptoms of septic shocks are fever, chills, confusions, anxiety, difficulty breathing, fatigue, nausea, vomiting, cyanosis, tachypnea, tachycardia, and different types of infection shows different signs and symptoms. Restorations and maintenance of adequate tissue perfusion and oxygenation is important to prevent multi-organ dysfunction syndrome. Septic shock patients has a mean arterial pressure of 60 millimeters of mercury or greater, or a decrease in mean arterial pressure of 40 millimeters of mercury from baseline. Also, an elevated blood lactate level, a central venous pressure of 8 millimeters of mercury or greater, central venous oxygenation saturation of 70% or greater, and maintaining a hemoglobin of greater than 9 grams per deciliter. Some medications used are alpha-beta adrenergic agonists, and that's used to induce vasoconstriction and increase the mean arterial pressure if it's low. Vasopressors are a second-line agent in treating septic shock. Antibiotics are used to fight bacterial infections, and corticosteroids has anti-inflammatory properties that maintain vascular tone and should be used within 8 hours of diagnosing septic shock so for it to be effective. Supplemental oxygen should be administered to all septic patients. Early intubation and mechanical ventilations are considered for persistent hypotension and oxygen requirements. If the lungs are affected and acute respiratory distress syndrome is present, goals of mechanical ventilation should be to improve gas exchange, reduce the work of breathing, avoid oxygen toxicity, minimize high alveolar pressure, avoid further damage to the lungs, allow the injury to heal using the acute respiratory distress syndrome protocol.